Erickson, you have to understand, and that's what my personal opinion would be, because you have diabetes, you have high blood pressure, and you recently had undergone a brain surgery because of hemorrhage, and you are on 6 different medications. Your blood pressure is not well stable. You have type 2 diabetes as well. You bleed a lot as well. Your bleeding doesn't stop very easily, and because of all the medical conditions that I have, I think it's not a wise option to treat you just in the dental chair or in the dental office. It would be a good idea that we do that extraction. I do understand it's a very basic extraction, but just in case something happens, in the hospital they have the protocols to follow up and cater you there. We might not have it in the clinic. I'm not trying to scare you here, but this is a preventative protocol we are following. And I would do the same if I'm treating any other family member of mine as well. Treating you, all my patients, as my family, and I would like to make sure that I follow the same protocol for you or any other patient, because my patient's safety is my first priority. Now, if you say that in the exam, and then you say, I don't want to remove the tooth, even if it's a mobile tooth because of your medical conditions, to not in today in the dental surgery, because of we would prefer you to in the hospital setting or in the dental hospital, you can justify why I'm saying it. Now, the other scenario, I might say that because of the medical condition and because of the mobility of the tooth and stuff, I might do it today. But if I can justify it, do it. That's what they want to see. Behave as a dentist. It's your patient. You have to follow the protocol and justify why you're doing it. As soon as you do it, that's all good. So you can do the scenario in any way you like. You just have to have it in your mind that, can I justify what I'm doing? Makes sense. Relax. Again, relax. Even in the middle of the scenario, you'd notice that you're rushing. Every time I used to do role play previously as well, the candidate was like, what I was thinking that we should do this and tomorrow, and because they have script in their mind, they're looking at the timer and there's like 5 minutes already gone. I haven't covered it. Relax. That is very, very important, because as soon as you're relaxed, your tone is relaxed, you're not rushing, you can balance out a lot easier. So it's about being confident, but at the same time, just analyzing what you're doing. Analyze your mistakes. When you practice every time, again and again and again, you analyze your mistakes, and that's why you have the study partners. And then you get better next time, and you'll be like, let's not do this. Discussion. Discuss is the most important thing. My father always tells me that when they were in the fellowship program, they had a big line written outside the College of Physician Surgeons, Pakistan. And my father used to tell me, he still tells me again and again, if you read, you forget. If you write, you understand. If you discuss, you remember. Now, the problem, what happens in today's generation to all of us, we get notes from someone. So we just read, we don't write. And that's why I never give my notes of OSCE to anybody. I always tell them, you make your own notes. As soon as you start making your own notes, you have read it, but now when you write, you understand it. It gets a bit of a feedback on your brain that what you registered, it's registered there. And when you discuss with your study buddy, now it becomes a part of your memory. But if you skip one of the steps, you will notice people who don't make their own notes, they still struggle remembering it because you're not registering it in your brain. So making sure writing your own notes. Now the problem arrives here as well. A lot of people are like, where should I get the notes? You don't need, and that's what I'm again and again saying, communication is all about what you say it and how you say it. It's not about what information you're giving. Yes, you need that basic information, but you're already a dentist. You already know 90% of the stuff. It's about how you say it and where you say it and where you don't say it. And that just balances out really, really well. In my personal opinion, you don't need notes from anyone out there. I've seen notes of all the people who are actually teaching communication. I've literally seen their notes. I want to ask, and I asked some of the students in Canada, can you tell me, is it not same which is in therapeutic guidelines? Is it not same in adults? It's not the same in version 4 document? What's new that they're mentioning that you don't have it in those 3 documents? And when you actually assess it, that's what they've done. They've just combined all the 3 and given it to you. I personally say version 4 document, Odell's, and then your therapeutic guideline. That's more than enough. And then you discuss, and that just very, very good. Again, practice is the key. Most important is practice. Until unless you don't practice, it's same like crown prep. You do 5 crown preps and they say my margin is still not working because you haven't practiced enough. You be confident, all that we talked about, natural instincts and all that, how to communicate effectively, fearless speaking. Once you practice, you become confident. When I did my first crown, I was not comfortable. Now when I go up, I'm just singing and prepping my tooth and prepping multiple teeth and full mouth rehabs. I'm comfortable because I've done so many times now. That's when you become fearless. Nobody becomes fearless and all that relaxed and confident and all that without practicing. So without practice, nothing's going to come to you. But at the same time, it's very, very important. Okay? The thing, I think the tone is not there, but just making sure tone is very important. We have to understand this. Everyone does it, the tone, they're rushing. They're like, okay, let's take a history today. And what we will do is I will also tap the tooth and then we might take an x-ray as well. Is there anything else you would like to add? It feels like they're rushing. What are you doing? Are they scared or what's happening? As soon as you become slow, as soon as you go slow, the same line becomes so much more appealing and soothing. And just listen to this. Same line. Okay, Mr. Peterson, I will be assessing the tooth for you. I will also be tapping the tooth for you and also might take an x-ray. And then we'll advise you what needs to be doing. Same line, I think pretty much similar. But, I was just going slow, so my body language is comfortable, my tone is relaxed. All of a sudden, I feel like I have more control in the OSCE scenario or a communication scenario. And that's what they want to see, how much control you have to communication. Now, when it comes to time allocation, the first 3 minutes, most important. The first 3 minutes are the most important. If you don't work on the first 3 minutes really well, all this not gonna work. So the first 3 minutes is you get the pad and then OSCE scenario is right in front of you in the screen. You enter the room and they give you the first 3 minutes to make an outline. Now a lot of people just sit down. No, use that pad. They will give you a pad right there. You make a pad, just circle it to whatever is there, and then you make something like, let me just show you something just to show you, because this is very, very crucial. So for example, if it says emergency patient, okay, big swelling in the face, for example, that's the scenario. Okay, what we want to do is, the first thing I should do is emergency patient, swelling. I'm reading, but at the same time, I'm making some pointers for me. First one would be referral. They're in pain. Medical history. Systemic signs. Now someone also says coming away from 3 hours away, drive 3 hours away. So whatever the main points you get, you have the pad there and you mark them in the first 3 minutes. So now when you're doing it, you're not scripting it, but at the same time you're just looking down and say, yeah, I've covered most of them. Oh, actually I missed this point. I missed smoking. I missed this particular point that they were saying that they have difficulty in breathing now. They have difficulty in swallowing now. So the first 3 minutes are the most important. Whatever the scenario is, this emergency becomes uncooperative child, for example. Uncooperative child. Same thing. Can you do it or can you not do it? Referral or no referral? Pain or no pain? Medical history. Now, sometimes we need to talk about sedation. Maybe the nitrous oxide. We have to talk about the diet. We have to talk about a routine checkup and clean, 6 monthly. We have to talk about fluoride. Sometimes they say they have a water tank system. That means they don't have fluoride. So these kind of hints are already there in your scenario. There must be something about the diet that he has a bit of a juice before going to bed. Lot of sugary diet. So then again, frequency of the intake, skipping meals or what they're doing, how much water they're drinking. What's the nighttime schedule? Like, do they brush twice a day? Do they use a fluoridated toothpaste? Snacking between meals? Avoiding sticky stuff? Not having anything 1 hour before going to bed, just water? And someone supervising them or not? When was the last dental checkup? Emphasis on the 6 monthly. So what I'm saying, so the first thing is your mapping. This is called as mapping. The first 3 minutes will be your best friend. If you don't do this correctly, everything else you do does not fall in place and you miss 1 or 2 points. So this thing, which is your mapping, should be the first thing you do as soon as you enter the room. You read the scenario. In the first 60 minutes, you read the scenario. Then you start making this quick mapping that, okay, this is the scenario, uncooperative child. These are the 6 important points that I need to cover. Now, if it's an implant patient and they talk and tell you, I have calcium disorder, I have osteoporosis, I'm a big smoker, and I need implant, and you don't talk about smoking, and you don't talk about the osteoporosis or the medical conditions, about their diabetes, and you finish the scenario, what do you think about passing the scenario? Or are you putting yourself at a lot of risk? You know what I mean? So that's why the time allocation is important. But before you dive into it, the first 3 minutes, your mapping should be ready. So the first 60 minutes, you read what's written. You know what the scenario is. Then you have your mapping ready. Read the scenario again. And before we start proceeding with your communication, your map is already ready. You exactly know these are the 6 points I cannot miss. Or out of the whole scenario, I need to make sure I'll do my scenario, being natural and the points we discussed, but I will be pointing out these 6 important points that cannot be missed. Now let's talk about time allocation. I generally like to finish in 8.5, 9 minutes, because when you do 8.5, 9 minutes in the exam scenario, you end up doing 10. But if you plan for that 8.5, 9 minutes, I have noticed that generally in the 10 minutes, even if you take 10 minutes, you've covered a good 75-80% important bits. So the passing chances are pretty high. Now, the first thing we do is, because it's a conversation, right? Introduction and breaking the ice. So the first 30 seconds, now I don't want you to spend the next 5 minutes talking about how's your days and, do you like playing any sports? And I'm talking about a quick 10 to 15 seconds, maximum 30. Whenever this time slot you see, I'm talking about maximum. You cannot go any more than that. Now, this is a basic outline. Okay? It changes for everyone. Sometimes it's a new patient. You say, hi, my name is Dr. Mac. I'm one of the dentists here. I'll be looking after you. You're here for a routine checkup and clean. Welcome to the practice. Is there any concerns from your side? We'll be doing a detailed assessment.